Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we are doing our monthly Q&A, question and answer episode with Maria, the producer. And as I've said in the past, you guys are getting very good. Your questions are getting better and better and better. So let's dive in, Maria. Start with the first. Who's the first question from?
Okay, from Barbara Riddle 57.
Barbara Riddle 57. What's the question?
I have a lopsided smile on my right side of my face. Will injections help with that?
Okay, so facial asymmetry, that's essentially the concept. And the fact of the matter is that facial asymmetry, unless it is significant, is what it is. It's very common. 99.9% of people have asymmetry. One brow is lower than the other. When they smile, like when I talk, only the right side of my face moves. When people smile, one side's higher than the other. That is pretty much just par for the course. The question is, if it's significant or severe, maybe surgery and or fillers can help, but it's got to be significant for it to make a difference. Lastly, the difference between a static problem and a dynamic problem is, a static problem is I'm sitting here and one side of my face is different than the other. That's way different than when I smile or squint or animate, use my muscles, and it becomes asymmetric. You can almost never fix an anatomical issue when you're animating, meaning, oh, when I smile, it's higher on that's just the way you smile. Whereas if it's static, meaning it's just there when you don't move, you might be able to improve it. But by and large, I wouldn't really mess too much with facial asymmetry. You're going to end up being a losing proposition.
Okay, this one comes from Carfrody. Can you talk about eyebrow transplants?
Carfrody. Okay, actually, transplantation in general has come, oh my God, talk about advances. Hair transplant used to be plugs, meaning they used to take 3 or 4 hairs at a time as a cluster and put them in. And then that was very obvious because they were plugged, literally little islands of hair. What then they started doing is then they would take the strip from the back of your head, take that strip, chop it up into individual hairs. And now it's even more amazing. You can go into the back of your head and pluck out individual hairs and insert individual hairs. So the key to hair transplant now, whether it's your eyebrow or your beard or your head, is that you can put single follicles in, meaning one hair, one hair, one hair. Why that's important is each hair can be placed at its own direction. So like whereas before they would all going in one direction, now you can create parts. And so when it comes to transplanting of the eyebrow, very effective. You put in single hairs, and then now those hairs can be placed at an angle to mimic eyebrow hair. So I think that if you find a good hair transplant surgeon, you should be rocking.
Laura Lakova.
Laura Lakova.
Is chin filler better than an implant?
So in general, when it comes to facial filling, we have volume in the form of a filler. That filler can be from a syringe off the shelf or fat versus implants. So my philosophy is that when it comes to your chin and predominantly your jawline, you need to replace like with like. You need bone. This needs to be chiseled and sharp. And when you use filler to take the place of a chin implant, it usually is rubbery and soft and mushy, and it doesn't do the same, it's not as effective as an implant. So when it comes to the jaw area, I tend to like implants. So I'm 100 out of 100 times I'm going to put a chin implant over filler. And when it comes to the cheek area, I tend to like volume in the form of a filler because this is generally a softer area. So I don't like filler to the chin. I think it looks rubbery and fake.
I think I saw a lady the other day had something similar, and it looked like a little ball in the tip, and it just looked weird.
Yeah. It doesn't look very natural.
Okay, this comes from Rosalie 817.
Rosalie 817.
Does everyone need muscle repair even if we don't want it? What will your results be?
Okay, so it's a very good question. So the muscle repair that's being questioned is during a tummy tuck, do you have to have the muscles repaired? What if I don't want it, and what happens if you don't? So, number one, if you've never had any children, then your muscles should be where they were when you were born. They should be exactly where they are. Now, you can still be overweight, you can still have loose skin, but your muscles should not be separated. When you go to a traditional abdominoplasty or tummy tuck gallery, you're going to see two major changes. Oh my God. One is loose skin has been removed, so there's a tightness. And two, their protuberance or their bulge has been flattened. That's muscle repair. So tightening of the skin, skin removal, and then repairing of the muscle, flattening of the abdomen. So if you are a patient that has protuberance, AKA I've had 2 kids or 3 kids, and you go get a tummy tuck, and all they do is remove the skin, you will be a tight barrel. You will be tight, meaning there'll be no loose skin, but you will still be protuberant. That protuberance will only go flat if you repair the muscle. There is no liposuction, you can't go in, it's muscle damage that hasn't been tightened. So if you don't want it, you don't have to have it. I don't know why you wouldn't want it. I've never done an abdominoplasty in a woman who's had children with diastasis and not repaired the muscle. That's just like, I want a house, but I don't want a roof. It doesn't make sense.
My realtor H asks, can you create a six-pack with tummy tuck?
Okay, so my realtor H. So can you have a six-pack with tummy tuck? So the answer is yes and no. Let me give you explanations. So one of the things that happens when you do a tummy tuck is A, you bring the muscles into alignment, that's repairing them, and B, you pull the skin so it's tight. Now your abdominal wall is ready and primed for you to work out. So let's imagine you start working out and working out. You can actually now see your six-pack. Whereas before you had the tummy tuck, you could work out till the cows come home and you'll never see the six-pack because it'll be hidden over the loose skin and the muscle separation. So one advantage of a tummy tuck is now you can actually see the six-pack. The second thing you're referring to is, can I actually make a six-pack? There is something called high definition liposuction. I don't do it. I'm not a fan of it. But what essentially happens is you do your tummy tuck, it heals, and someone goes back with liposuction and basically etches the lines of a tummy tuck. So they remove the fat in just those areas, giving the illusion that you have a six-pack. Remember, a six-pack is muscle hypertrophy. Muscle have expanded. So shy of working out, you're not going to get muscle hypertrophy. So if you want to fake it, you can liposuction your abdominal wall to look like it, but I think it looks weird.
This one comes from Rosalie 817. This is another question she asks. What should you do to avoid complications after a tummy tuck?
Kind of a broad question. I'll answer it in twofold. One, the general things. You want to avoid complications from all surgeries. Tummy tuck's no different. So those are, if you got a bunch of medical problems like Kanye West's mom, don't have surgery. If you have a bunch of medical problems, at least get them improved. Like if your diabetes is out of control, improve it. If your blood pressure is out of control, you want them improved. You want to go somewhere reputable. I mean, we've talked about it 1,000 times. I mean, we just did a post about a woman who died of liposuction because she had a pediatrician do her surgery.
Oh, I know. I can't believe
right?
that.
I mean, and unfortunately, like, oh my God, like it's some random, it happens all the time. You want to make sure you go to a legit person, and then you want to make sure that, you are basically following instructions. Now, in particular to a tummy tuck, you want to make sure you don't get a blood clot because there's a risk for that. So your surgeon should have you walking early, be using blood thinners during your surgery. You also want to make sure that you don't separate, your wounds don't come apart. So you don't want to be overly active early on. So those are specific to a tummy tuck.
Okay, well, we're going to go on a break.
Break it is.
Because we have a question about inverted nipple procedures.
Ooh, inverted nipples. That's like last time we did Q&A.
Yeah.
You did a teaser with labias. You know how to find the teasers to get people to come back to the second half.
And the other question was bloc capsulectomy.
Good job. Bloc capsulectomy. That's a mouthful. All right, well, let's take a quick break. And then when we come back, we will continue with your fantastic questions. We'll be right back after this break. Welcome to the second half of Plastic Surgery Uncensored Q&A session with Maria, the producer. All right, Maria, talk to me. What's the question?
Okay. From La Baby 13.
La Baby 13.
Can you explain inverted nipple procedure and how it's corrected?
Inverted nipple procedure and how, okay, so I actually think this is a really undervalued, underspoken, super powerful surgery. So there are thousands and thousands of women who have an inverted nipple, 1 and or 2. That means that when you're standing there in front of the mirror, your nipple is not flush, nor is it projecting. So normal is my nipple, that's the part that projects, not the areola, is projecting, or in some instances, it can at least be flush. But for some women, it actually goes inwards, mildly or very severely. Then the question is that a permanent problem, meaning it's fixed and it never comes out, or is it transient? Like when I'm cold and I'm stimulated, it comes out. The reason why that's important is the correction of it is permanent, meaning it affects things permanently. And generally speaking, if your nipple does come out once in a blue moon and you want to breastfeed, you might want to not do the procedure till you're done breastfeeding. So the procedure is, what causes the inversion is that there are these remnant scar bands that are, imagine like the ropes of a parachute, are pulling the nipple in and they're tight. So the treatment is to make a small incision around the nipple and to release those cables. And when you release those cables, the nipple will then come out. Then you put a few stitches and close the space behind it. And as a result, you get the nipple to either come out and or be flat. It's actually very effective, very powerful. And for someone who has inverted nipples, it's a game changer in terms of intimacy and confidence and feeling comfortable being naked.
Okay, my next question comes from Artyom Aram.
Okay.
Why would you get an infection after a breast lift?
Why would you get an infection after a breast lift is why you would get an infection after any surgery. Number one, there was some contamination or break in sterility during surgery, right? So you and I walk in like this, we're dirty, right? I just took a shower. Yeah, but you still have bacteria on you. If I swab your belly button or I swab your nipple, there's like thousands of bacteria. So the breast is not sterile. It's not a sterile organ. So we have to prep you during surgery, and then you become sterile, but then there's still some material that comes out of your nipple during surgery. So if they're not very clean or sterile during the prep, you could get an infection. 2, your instruments have to be sterilized, right? I operated on you, and then I got to operate on the next patient. Well, they have to sterilize your instruments. They could break that sterility. The instruments aren't necessarily sterile. Then there is the aftermath. In other words, you're healing within the first week or 2, and there's bacteria on your body, and you get an infection during that. You should generally, very rare to get an infection after the first 10 days or 2 weeks. I mean, once it's healed, it's healed. You're not going to suddenly just get a random infection in 5 months from now.
Okay, this one comes from Martha O.
Martha O.
I want to do a breast lift and put a small implant, but I am a hairdresser. How long should I wait, stay away from work before I...
Okay, so I am a very strict surgeon. Surprise, surprise. So my aftercare is stricter than most. The reason I'm strict is because I want no issues. And I want you to do well and go live your life without complication. During the initial post-operative period is when shit goes wrong, right? It doesn't go wrong years later, it goes wrong within the first 6 weeks. During the first 6 weeks of healing, you are vulnerable to a complication. So, my general rule of thumb for all surgeries, breast lift and implant included, is you want to take it easy for the first 10 to 14 days. That means just try not to go to work, don't go to the office, just let the wounds close so you don't get a hematoma and an infection. And then from week 2 to week 6, that's 1 more month, I don't want you exercising. Then at 6th week, do whatever the hell you want. Go to the gym, go hiking, go into a swamp, go jump out of an airplane, whatever. So to answer her question is,
she's a hairdresser.
She can go back to work probably at 2 weeks, depending on how strenuous of a hairdresser she is. If she feels like her hairdress work is like lifting weights, then she needs to take it easy. If she's like, I'm pretty cash and I'm just taking my time, then it's fine. Moving your hands is not an issue. It's lifting heavy weight,
or pulling when a blow dry.
Right, but even when you're pulling on a blow dry, it's not that intense. Now, if she happens
I don't
to...
think you've had a blow dry.
I haven't.
I could tell you.
But if she's, for example, blow drying super thick, long Indian hair, and she breaks into a sweat, then maybe she needs to wait a little longer.
Okay. Next question comes from Nurturing 884069.
Wow.
I have a history of blood clots. Can I still undergo a mommy makeover or elective surgery? If so, what's the protocol post-op?
So that's a great question. We pretty much get that almost every time we have a Q&A. There are many people that have history of blood clots, either because something just went wrong that one time or they have a predisposition for it. I've operated on hundreds of patients with histories of blood clots. That being said, I'm super conscientious about it. Number one, I never do it without the involvement of a hematologist. So let's say you had a blood clot, we then make sure that the hematologist is on board. The things that we do to prevent blood clots are, one, we give you blood thinner at the time of your surgery. A lot of surgeons don't because they're afraid that you're going to bleed. There's no science behind that. We give you blood thinner at the time of your surgery. Two, when you're asleep and you're unconscious, we put squeezing devices on your legs so that you get circulation through your body. Three, we make sure you ambulate, meaning you walk immediately. You do not want to have surgery with a history of blood clots and lay there for a week watching TV. So that night you get home, you start walking to the bathroom, then to the kitchen and so on. And fourth, if you have a history of blood clots, you and your hematologist and your surgeon should have a post-op blood thinner protocol. So in other words, they give you medications, usually it's subcutaneous, that keeps your blood thin for about, 3 to 7 days so that your risk of blood clot is almost diminished. Again, your surgeon should be working closely with your hematologist, but 100% you should be able to have surgery.
Okay, this one comes from Little 89.
Little 89.
What can I expect from an explantation aesthetically? Is an bloc capsulectomy necessary for explantation?
So this is probably the hottest topic right now. We've talked about it on multiple occasions. We had a few episodes that were specifically designated to explantation. So it depends on why you're explanting. If you are explanting because you are in the BII, breast implant illness world, meaning I want to remove my implants because I believe that the implants may be the reason why I don't feel well, then the current thought process in that world is that I'm going to remove my implant as well as remove the capsule around it. And the way they suggest to remove it is en bloc, meaning implant and capsule as one unit all out together. An en bloc capsulectomy or complete capsulectomy is what's discussed in that world of BII. If you're removing your implant because, I don't know, it's just too big, I'm over it, I feel fine, I just don't like the way it looks anymore, then it's not necessarily do an en bloc. The capsule is your own tissue, it's not foreign, it's got blood supply, it adds volume, albeit a small amount, and so you don't want to just willy-nilly take it out for no reason unless it's really calcified and thick and ugly and things like that. So that's the whole concept of whether or not I need to remove my capsule and whether or not it's en bloc. In regards to the aesthetic, it's very simple. If I remove your breast implant and you have absolutely no breast tissue, then your breast lift reconstruction will not look aesthetically good. You just don't have any breast tissue. If I remove your implant and you have some and or a lot of your own breast tissue, then your breast lift reconstruction should look pretty good. So that is not necessarily a matter of your surgeon's skill, although that's important. It has a lot to do with what we're working with. And often patients come to me and they want to get an explant and I examine them and I'm like, wow, 85 or 90% of your breast is really implant. You need to be ready for the aesthetic outcome. It won't be necessarily all that great. What about fat transfer? I heard you can put fat transfer. That's a pie in the sky. If you have essentially no breast tissue and you take out a 350cc implant, there ain't no fat transfer you're going to put in your breast that's going to make it look suddenly beautiful and aesthetically acceptable. So you just have to be ready for that. And if they tell you otherwise, they're lying to you.
Well, that's it for now. But
that's it?
We have some more reviews.
Ooh. Reviews. No negative reviews, please.
No negative reviews.
Okay,
this
good.
one comes from Best in the West.
Best in the West.
Well, it's titled Best in the West from 3 licks 3.
Oh, okay. I'm the best in the West.
Yes, you're the best.
I thought they were the best. Okay.
No, so thankful to have found this podcast so informative, straightforward, and honest. I like the variety of topics. I enjoy the interviews of experts and patients alike. Doctor has a fabulous sense of humor.
See? Who says I was serious?
I've already learned so much and look forward to the episodes. Thank you so much. Here's another one.
See?
Yeah.
Who said I was serious? That last interview says I'm not serious.
This one comes from BFT is amazing. Dr. Rahban. Ever since I found Dr. Rahban's podcast, I could not stop watching. He is so well versed in his expertise and he tells you how it is. It's refreshing to hear from a plastic surgeon with an unbiased opinion.
Oh, that's lovely.
So
well, there you have it. Okay, so I am funny.
You are funny.
God, I don't know what she's talking about.
It took a chuckle out of me for sure.
All right, guys. Well, that's a wrap. Thank you so much. We love your Q&As. We're going to do them as we always do once a month. So, as always, before we depart, I ask two requests. One, if you love our show, please forward it, pass it on to friends. Just forward it. Hey, you want to check this out? You never know which one of your friends is going to go get some catastrophic surgery and you're like, oh, you should listen to this podcast. The second is, write something nice. See how nice that sounds. We really appreciate it. Everyone that's here appreciates it. And furthermore, it helps boost the ranking of this podcast, which then gets it out to more listeners. So, as always, your host, thanks again. Until next week, signing off on Plastic Surgery Uncensored.